Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, today we're diving into why our hands are our greatest tools. Anae and Sian Johnston from SAAPRA discussed two research articles focused on massage therapy. Massage provides us with immediate feedback and the ability to detect subtle changes in tissue and movement that machines simply cannot replicate. Before we head over to this exciting topic, if you're looking for some free online learning, in addition to our membership, which offers over 500 hours of vet rehab specific learning for equine, small animals, or hydrotherapy, we also provide webinars in our limited access membership. The latest updates include core strengthening and lumbosacral stenosis, what can we learn from human back pain, what's new in hydrotherapy research, and managing the musculoskeletal health of the stabled horse. Now, Onlinepethealth members, you can access these webinars in your membership, and for non-members, they're available at onlinepethealth.com/free. If you have not bought your ticket yet for our annual veterinary rehabilitation conference, it's online. It's called the Vet Rehab Summit. It's on the 31st of August. We will be delving into the ethical dilemmas that vet rehab therapists face. You can find out more at vetrehabsummit.com, and of course, our Onlinepethealth paid members, you get free VIP access to the summit. A quick word from our sponsor, Curacao Vet. Curacao is owned by Nada Robinson. Nada first developed her courses at the Colorado State University, where she started the Medical Acupuncture for Veterinarian Certificate program in 1998. In so doing, Dr. Robinson developed a science-based platform for veterinary acupuncture, which was the first of its kind. And today, Curacao Vet offers a comprehensive curriculum in integrative medicine with a rational, evidence-supported foundation. They've got courses such as medical acupuncture, photomedicine, botanical medicine, medical massage, and integrative rehabilitation. So you can discover more about Curacao Vet at curacao.org, and you can also see them at this year's Vet Rehab Summit. All right, over to Anae and Sian.
Hi guys, and welcome to this month's Journal Club Research Refresh collaboration with SAAPRA. Sian, welcome and thank you for joining me.
Thank you. Thank you for your input as always.
Awesome. So our theme today is massage, right? We're continuing on with our hands are our greatest tool, and today's episode is the massage edition, which is pretty cool because we all use massage. So Sian, what is this paper about?
So within the K9 article that we looked at, also quite a lot of description, but I think what they did with this research paper is they took a bunch of case studies from some veterinary practices. They worked with 65 different massage practitioners, and they all had a set form that they had to fill in, which was evaluated by both the owner and by the practitioner. And they had to compare things like gait, posture, daily activity, behavior, performance, and quality of life. So they had lots of different practitioners. They had lots of different dogs. I think that there's not a standard age, breed, anything like that. So I think there's lots of variation within the different cases that they are treating. But by doing it in the way that they've done it, they have given the research quite a set structure. So they definitely tried to standardize it as much as they could. But by doing it in the way that they did it, they also were able to have a very large sample size. And I think they ended up comparing 527 dogs. So they kind of like weighed up the structure of how they did the research with a large amount of dogs that they were able to compare. So I think in the way that they did it, they definitely created as structural of an approach as they could for this type of paper.
Awesome, thank you. I really like the way that they did this paper. So let's see. So these are the potential benefits. They just shared that for us like that. I'm going to skip to our methods, right? So here is their statement of what they're doing. Quantitative research is required to understand the potential uses and effects of massage therapy in canine veterinary practice. The current cross-sectional study aimed to investigate quantitative changes in pain across multiple indicators reported by dog owners and practitioners of the Canine Massage Guild UK in a large sample of dogs who were referred by veterinarians due to soft tissue damage or injury or myofascial musculoskeletal pain. Data was extracted from case files for over 500 dogs who received 1 to 3 treatments using the Lenten method of massage therapy. It was hypothesized that pain, both number of issues and severity, would significantly reduce post-massage therapy and quality of life would improve. Okay, so in terms of their method, data from a convenience sample of 527 dogs from the UK, Ireland, and Channel Isles in Spain were collected. And not all of them were included at the end, I think. But it's so rare for us to have that kind of sample size within our kind of research pool. That's very exciting. No inclusion criteria were set, although practitioners were asked to provide data on a representative sample of dog types routinely seen in practice, right? So data on the dog's age, life stage, sex, neuter status, breed, all of that was included. 71 breeds were represented, and most dogs were pets and adults, and males and females were equally represented. So I think that it is important that they share a little bit about the practitioner training and the method, the way that they did. Even though that feels descriptive, it gives us a really good handle of the method and why this was comparable, why this was valuable, right? So Massage Guild practitioners train for 2 years in clinical canine massage therapy. And they need to train in several different techniques, right? So 60 techniques spanning myofascial release, sports, Swedish, and deep tissue massage, and then the Lenten method. So the Lenten method is a unique 3-tiered approach to treat musculoskeletal pain in dogs. Tier 1 involves a full body advanced palpation, and Tier 2 is, they actually have a nice diagram. Let me grab that. Right, so the Lenten method. Tier 1 is advanced palpation, or a specialized procedure where therapists read and translate muscle, fascia injury, or dysfunction using precise palpatory techniques, grip modulation, and force control to comfortably assess pain. The second tier or step is body mapping, where a comprehensive standardized anatomical map of primary and secondary areas of muscular injury and fascial dysfunction is created. And this promotes consistency between practitioners. And then tier 3 is 7 protocols of treatment, essentially. So a unique set of complex direct myofascial releases utilized to address chronic structural imbalance and presenting pain, preceded by sports, deep tissue, and Swedish massage. So this step of the tier means that every dog is still treated individually, right? They're not performing the same massage protocol. It's not like one protocol that's being performed on every dog. Every dog is being treated for that individual dog's presentation, but the way that they're assessing and reassessing means that they accumulate data that can be compared over time. So I like that. And I wouldn't necessarily call this unique, right? We are doing this in one way or another within our profession. We are evaluating, tracking or mapping, and then treating and repeating. So I like that.
I really, really like this in the sense that, there's a way that they have really made the effort to try and standardize it and make the information comparable between practitioners. I mean, they've got 65 practitioners that they're comparing. So I do think the way that they've structured it, they really have made information that people collect day to day valuable and comparable. So I really like the way that they do it, because it shows that it is possible in a way where we can, I don't know, as I say, be able to kind of collect our information and compare it and get information out of it that can be useful.
Yeah, and for me, this is less about how this particular paper was accumulating their data. It's more about the industry standard that has been set for practicing massage within that UK Massage Guild. They have to adhere to a standard of practice, and they have to adhere to a specific method of working. And because they do, that means that their retrospective data can be used for something like this. It can be used in a research study where we're comparing their findings to each other. And that's massive. That's massive. I mean, evaluating the effect of massage is extremely broad. And in general, that would be a bad study focus because it's too broad. But it's work.
It shows you it's possible. It shows you it's possible. So I think that's what's exciting about reading something like this. I was like, I found it quite amazing. Like I was quite blown away by this.
Because of the possibilities that it opens up for us to study further. Yeah. Okay. So the practitioner, they reviewed the medical history of the dog and learn, okay, no, that's still how they work. So that's cool. So that's basically just describing how they are going to go through a treatment, which is to review the medical history, to look at the owner's concerns and observe the dog. And then they conduct a full dynamic gaze assessment, a static postural analysis before then starting with tier 1 of the Lenton method. So pain is therefore assessed before and throughout tier 2, and 3 sessions of clinical massage therapy are provided over 3 to 4 weeks to allow tissue yield. And I find it interesting that this is also standardized, right? 3 treatment sessions. Pain reevaluation occurs before each session to gauge the effects of the previous session. So let's jump into the data collection. You've already mentioned 65 practitioners. A self-selected sample provided data, so the practitioners came forward and provided that data. Information requested included life and medical history of the dog, referral diagnosis, cause and timescale that led to referral, the list of presenting issues, and the severity of each issue. So now we have, they're evaluating data that's coming from different sources. The veterinarians providing a medical history and a referral, and then the practitioner is looking at gait, posture, so 5 different areas: gait, posture, daily activities, behavior, and performance. And then there's qualitative data on the quality of life that was also collected, and that's coming from the owners. So the owners practitioners were asked to summarize the dog's quality of life into a word or phrase of their choice, and the overall response to massage therapy was determined by the practitioner as either yes, the dog did respond to treatment, or no, the dog did not respond to treatment. And all they needed to say yes or no was to have a change in one or more of these parameters that they were measuring. So a positive change in one or more of the parameters. And initially, when I looked at this, I was like, that is very, very, very subjective and biased, because of course, I want my patient to have responded to treatment. So yes, they have, right? But if we are measuring any of these things, and we're doing that objectively, and we base this yes or no answer on what changed in my treatments, then that is a little bit less biased. Okay, and so those client files were a combination of veterinary notes and the practitioner's observation and owner reports, right? And so the data was really an amalgamation of sources, which makes it very difficult to analyze and work through. So it must have taken them a very long time to process this data. I don't know if there's anything you want to add or comment on there, Sean?
Yeah, I mean, I think again, like they've balanced out the fact that it's quite a broad way of doing a study. There's lots of different variations in terms of, the sex of the dog, the age of the dog, things like that, where usually I think what they would do more in like a clinical study is they'll kind of hone in on those things a bit and try and remove any variables where there's lots of different variables within this that could be influencing some of the findings. But, I still think that they've done it as best as they can, within the questions that they ask the practitioners. They try to create that structure. They ask quite set questions. So they definitely tried to at least give the structure of we are measuring this. And what are your thoughts on these different factors? So I still think that I like the design of it.
Oh, yeah.
I still think that it's something which shows a lot of value.
Yeah. And for me, again, I feel like it's that clinical applicability. I think that my feeling is because this was performed in practice, I can take the results back to practice. And that's valuable to me because a lot of research studies, the way that they're designed, means that this applies in this situation, whereas this study applies in clinical practice.
Yeah.
So I like that.
Yeah.
All right. So on to the results. Of the 527 dogs whose data was included, the practitioners provided data on overall success of treatment for 515 dogs. Of these 419 dogs, that's 95%, were considered to have responded to treatment. So we're considered to have a little yes, they did respond to treatment.
And that's a huge positive result compared to the paper that we looked at before, which was kind of like almost like this 50-50 of is it working, isn't it? Like to get that 95%, that's a hugely positive response that shows that massage benefited these dogs. Yes.
But what it does do for me is starting off our results with a statement like this throws up lots of red flags for me because how biased was this? How reliable is that information? How can it be, like, what does that mean? How could 95% of the dogs have responded to treatment? To what degree did they respond to treatment? So yes, very nice big red flag should be going up for everyone saying, hey, that's too good. That's too good to be true. Let's look at this a little bit more closely, right? So for each indicator of pain, the number of issues reported over successive treatments remained consistent throughout the study. So gait, posture, daily activity, behavior, and performance. Gait and daily activity issues were reported to be more numerous than posture, behavior, and performance issues, irrespective of the treatment. In tests of both an overall linear effect of treatment and of changes from treatment to treatment, no significant differences in the number of reported issues were found. For each indicator of pain, reported severity score reduced, indicating a marked improvement after treatment. After referral, the samples combined median pain severity was 2.4. After 3 treatments, this reduced to 1.4. Gait was consistently the highest pain severity score, followed by either daily activity or posture. And that's up to the second treatment for daily activity and after the second treatment for posture. A highly significant decrease in reported severity of all pain indicators across treatments was observed. By the time treatment was complete, the severity scores for all pain indicators had approximately halved, so 54% reduction in gait, Posture reduced by 60%, daily activity reduced by 54%, behavior by 51%, and performance by 41%. Okay, so that gives us a little bit of an indication of how much change was occurring. And that's decent, right? A 50% improvement in gait, posture, daily activity, behavior, and performance. That's significant for a lot of our patients. Over 93% of dogs showed improvement in reported pain severity score for one or more pain indicators after one or more treatments. So again, significant to think that after one treatment, we're having a measurable effect, and that continues over the 3 treatments. I'm going to leave out these variables for us where they're looking at the relationship with medication and pain and age and pain and different degenerative conditions and pain, because I think that just adds too much for us to discuss here. But the original cause did not interact with the improvements in common pain scores across successive treatments. So whatever the diagnosis was, it wasn't relevant to the fact that they all improved over successive treatments. Any thoughts on that?
Yeah, I think, as you say, it's a bit of a rabbit hole with these kinds of informations, because they are mentioning that some dogs are on medications, and this kind of brings in this. They've gone for a very broad approach, so it's honing in of how much of the effect is the medication having versus the actual massage. So because they've lumped everything together where they haven't taken the variables out. This is where you kind of lose that specific, like, what is the massage doing? Because there sounds like there's lots of different things that are at play. So, you've got to fine tune these kinds of things. And maybe there's different ways they could have done the research where they could have maybe taken out some of those kinds of factors.
Yeah, honed in on those kinds of factors. And they could potentially still do that even within the sample group. Get more specific in terms of the conditions being treated and the specific outcomes being measured. So look at one, really dive into that, and try and isolate what was happening in each one. All right, so there's a suggested general improvement in practitioner-reported quality of life over the course of the massage therapy. At initial assessment, 40% of dogs were considered to have a positive quality of life. This increased to 66% after the first treatment, 83% after the second treatment, and 92% after the third treatment. So I would again say that is quite biased, because if I, as a practitioner, or even the owner, even if the owner was reporting on this, you want to see a change in your dog when you're doing some kind of intervention, and you definitely want to see a change in your patients when you're treating them. So I would say that is quite a biased reading, but yeah, very positive nonetheless. So in their discussion, the study, in line with the aims, has shown massage therapy may be an effective treatment for myofascial musculoskeletal pain in dogs, as reported by practitioners and owners. Several veterinary practitioners and academies have anecdotally reported a reduction of pain following massage therapy in dogs, and massage therapy is a recognized part of rehabilitation therapy, where it is speculated massage can reduce pain by decreasing mechanoreceptor sensitivity or reducing inflammation. So I like that they bring this into the discussion, because it is about more than just the massage therapist working in isolation. It is about incorporating this into veterinary practice, into rehabilitation therapy, into more of a team approach. Of those 527 dogs, 23 were considered to have shown no discernible response to massage therapy. And they kind of go on to say that, well, that's odd. There must be a reason why these dogs didn't show a response, because all dogs should show a response to massage therapy, which I think, I don't necessarily agree. I think like myself, there are dogs that don't appreciate touch. And I prefer other modalities and other methods of intervention. Yes, that are different. So yeah, Sian, what do you think?
I would say that's fitting in very nicely with what you say with the bias is the fact that this is also, there's always that element of, we want to see a result. So then they are arguing their point about why they want to see their result, but they didn't get their result. So, in a sense, it's kind of that little bit of a clue of, there is a definite element of bias within the article.
Yeah, but even with that element of bias, I am excited about this research, and we've touched on this a few times, but I think that we really do need to find ways of incorporating standards of practice within how we work with different conditions and different patients. And also, even if at a minimum, that means we are using the same outcome measures, so the same clinical metrology instruments or the same scoring systems or gait assessment tools, whatever that is, that if we can standardize that as much as possible across practitioners, we're going to have information that we can compare with one another. So thinking of things like the FinFun neurological testing battery, right? That is so clinically applicable, it's ridiculous, and very much comparable between practitioners when you've put in some time to train with it. And you don't need fancy training, you just need to spend time familiarizing yourself with the scale before you just jump in and use it in your patients, or not the scale, the testing battery. So there are so many of those. There's a stifle testing battery. There's all our pain, our pain scoring systems, the canine brief pain inventory, and Cody, and there's a long list. We could just, if we just started using these in our practices on a day-to-day basis, we would already get closer to that goal of having data we can compare with one another that can be incorporated into retrospective studies over time, where we can really start to show what effect we are having, if any. And I think it's so important, even as a single practitioner, there is so much value in reassessing ourselves or assessing ourselves. If we say, once a year, every 6 months, we sit down with our clinical notes and we go through our DM patients and we go through our stifle patients and we look at the patterns that we can see, how much value, Sian, do you think you would get from that? Because you would go, hey, at the beginning of the year, I did X, Y, and Z, and then suddenly I changed my approach to Y and Z because that was in fashion, and look at the difference in what my outcomes were. Just that would make such a difference for us. But it takes time and it takes intention to say, I'm going to sit down and go through my notes for the year and reevaluate myself and look for those patterns. But what a difference could we make? What a difference.
And there's power in that information. Like, the thing is, it's just, what is nice about the paper is just setting that structure so that we can kind of do something and collect our information in a way where that we can maybe do something with the data that we collect. So I think that's what is so nice about this paper, because there is valuable information in it, but there's always just playing around with making sure that the information is of value and something that we can take something out of. But that is what is so great about this paper, is the fact that it shows you can definitely do it. And I think within our field at the moment, that information is valuable. It's very valuable. So we need to be thinking about ways in which we can do this, which is what this helps us to see.
Yes, exactly. So I think that more than the results of this paper being extremely overwhelmingly positive, the exciting thing from this paper is the way that it was structured and what that could mean for us in the future in terms of creating other studies to look at other areas. I think if we kind of wrap up our massage component, what would be your takeaway? What will you be taking back to your clinic and to your practice?
I think one of the points that we brought up in the equine paper, which is kind of, yes, there's an element of flexibility, but don't underestimate taking in the account of you've got the muscle lengthened, but is the muscle capable of creating that force? Is it capable of creating that strength reaction, which matches, okay, now it's lengthened? So I think that's something which definitely gives me something that I can take away from and just think about it a little bit, because it might dictate a little bit how I target the rehab from that point. So I really like that point.
Okay, great. Awesome. Thank you, Sean. Thank you for spending this time with me. I think that, our hands are our greatest tool. We just have to make sure that we continue to improve their skill and improve how we use them. So continuing education.
Yay.
Welcome to Online Pet Health. You guys are in the right place.
I think we all need to go for massages and just test it on ourselves, how much better we feel afterwards. That can be my challenge.
Awesome, Sean. I will take up your challenge and try and find someone that can massage me. My son, he wanted to give me one the other day, and I was like, okay, go for it. All right,
Thank
guys,
you so
have a
much.
wonderful day.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Curacor. Their sponsorship allows us to be able to give this podcast to you for free. So please go and check them out at curacor.org. Don't forget to bookmark the next Vet Rehab Summit. It's on Saturday, the 31st of August, 2024. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.